Thank you very much to our chair and to our ranking member and to our nominees. Thank you for your service. Thank you for your continued willingness to serve. And thank your families for us, too, because it is a joint commitment, I understand. I wanted to start with a little bit of a follow-up. Senator Lujan asked you about the opioid epidemic, and this is a question to both of you. The COVID-19 pandemic has exacerbated what already was a devastating mental health and substance misuse crisis in our country. I'm encouraged that you both have knowledge and experience in combating the opioid crisis through expanding access to substance misuse treatment and services and working to diminish the stigma that is still too often associated, in particular, with heroin. Dr. Levine, as Secretary of Health for Pennsylvania, you led the state's effort to combat the opioid epidemic for several years. Can you please speak to the importance of continued, robust federal funding for states as we work to turn the tide of the opioid epidemic?
Well, Senator, thank you so much for that question. I appreciated our discussion about this and other topics tremendously a number of days ago. You are entirely correct. The opioid epidemic, the opioid crisis and overdoses continues. It has been exacerbated during the COVID-19 crisis, and we have to continue to address this robustly. In Pennsylvania, we worked on prevention with a concept I call opioid stewardship, with opioid prescribing guidelines, a robust prescription drug monitoring program, et cetera, rescue with the medicine naloxone, and then expansion of treatment, particularly medication-assisted treatment. And we do have to get past the stigma associated with that. All of those programs required funding. We needed funding for our prevention efforts. We needed funding for naloxone and for further distribution of naloxone. And then we needed funding for treatment. One of the programs we founded was called Pennsylvania Coordinated Medication-Assisted Treatment, a hub-and-spokes model funded by the SOR funding. And so, if confirmed, I look forward to working with you, with the rest of the members of Congress, and with SAMHSA on continuing the absolutely essential, sustainable funding for the opioid crisis.
Thank you very much. And Dr. Murthy, if confirmed, how would you use your role to combat the opioid crisis and address the challenges in that crisis that have been exacerbated by COVID-19?
Well, thank you, Senator Hassan, for that question. You know, I think the opioid epidemic continues, unfortunately, to be a dire crisis for our country. I think that there are a few things, if I was confirmed, I would look to focus on, building on the 2016 Surgeon General's report that we issued on alcohol, drugs, and health. One would be to continue to focus on public education, recognizing that there is still an extraordinary amount of stigma around the opioid crisis, which prevents people from coming forward and getting help. The second thing that I would look to do is to take some of the core recommendations around treatment, particularly access to medication-assisted treatment, but also integration with primary care, and work with policymakers to see how we could advance treatment. And third, I would say, is to focus on prevention. Senator, in that report, in Chapter 3, we actually laid out a number of prevention programs which have been proven to work, to be cost-effective as well, to return far more dollars in terms of reduced healthcare costs, criminal justice costs, and economic productivity losses than the initial investment in those programs. But those are still not well known, and they don't always often receive the investment they need. So those would be a few areas that I would love to focus on with regard to addressing the opioid crisis.
Thank you for that, and I look forward to working with both of you on it. I want to turn to a different question, Dr. Murthy. Even as we expand access to COVID-19 vaccines, we face the continued risk of additional spread within communities and the emerging threat of new COVID-19 variants. Experts have been clear, one of the best ways to bring an end to the pandemic is to continue to wear a mask in public, avoid indoor gatherings, and maintain social distancing. Dr. Murthy, given the pandemic fatigue many people are understandably experiencing, how do you plan to use your platform to ensure that Americans continue to adhere to public health guidelines, even as vaccinations continue, until we're really, truly able to get the virus and its variants under control?
Well, Senator, it's a great question, and I think, to be honest, a lot of us are experiencing the fatigue from the pandemic. I certainly, am as well. I know a lot of us have been struggling for the last year, although, many certainly much harder than, have had much more difficult experiences than others. I think there are a couple things that I would seek to do, Senator. Number one, I think we do need to be consistent in our communication around the value and the importance of masks, and we have to follow, we have to lead by example in demonstrating that they work and they're important to wear. But the second thing I think is recognizing that that fatigue is real, and it's not, I think, a reason to judge people. It's just real. We're human beings. We're tired. That means that the faster we can also get people vaccinated, the more quickly we can return to a state where we can see each other, where we don't have to distance, where we don't have to wear masks all the time. And that's why I would also focus my efforts on the vaccine, on getting it to people, making sure people understood clearly what the benefits and are, so that they can make good decisions for themselves and their families.
Well, thank you for that answer. Thank you to the chair and ranking member. I will also just add that I would love to work with you and Senator Romney and others on the vaping issue, because I think people are not understanding the connection now we're seeing between teenage vaping and cigarette use later in life. And I very much look forward to working with both of you on that. Thank you.
Thank you.
Senator Tuberville.